Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Tom, good to see you.
Parker, it's nice to be back on our regular Thursday recording day.
It is a regular Thursday recording day. However, I'm not located in my usual spot. I'm in a slightly different setting today. That's how the summer seems to go.
That's true. It's nice to mix things up always, I think.
Yeah, that sounds good. So, welcome back to the Sit and Stay podcast provided by RipsyTech. I am Parker Anderson, the product manager here at RipsyTech, and you're joined by Thomas Tarshis, our, as I described last week, illustrious CEO. So, Tom, this week we're talking about group versus private practice considerations for clinicians. This might be providers who are new to the field or just existing providers. Maybe they have a private practice, they're thinking about a group practice, or maybe they're in a group practice thinking about a private practice. The grass is always greener on the other side, so let's break it down. So
right, and great topic and very true statement. The grass is always greener, especially in this mental health field where recent investments in this space have created tons and tons of job opportunities, and the rise in telehealth has also created tons and tons of job opportunities that you can do from your house. And historically, not that long ago, right, 5 years ago, starting a practice really meant you've got to find a building to be in, or have a room in your house you invite patients to. And that was an extra barrier that immediately put off a lot of people from seeking to start their own private practice. But all these changes with telehealth, a lot of money in mental health, a lot of companies fighting to get mental health clinicians because there's not enough of us, has really changed the landscape. And so people fresh out of practice or who've been in one type of practice, as you said, and are thinking about switching, I think it will be a fun topics to discuss.
So, with either option, there's got to be, advantages, disadvantages, or maybe some challenges that comes from, starting a practice versus joining a group practice. What might some of those be?
Yeah, and if we want to stick with the sort of advantages for a private practice,
let's go for it.
First. Yeah. I mean, I think if you're someone who really values your autonomy and you value being able to set your own schedule and not having to report to anyone, those are all predisposing factors where a private practice or solo practice would make a lot of sense. And in general, from population data, we know that people who work for themselves are significantly happier than people who work for others, with the asterisk that as long as you're making enough money to support yourself, that all things being equal, people tend to be happier when they're their own boss. And that's for a lot of the other reasons that I just mentioned previously. So if you've got that personality and don't like answering to other people and don't like having to be available for your job from 9 to 5 or 9 to 6 with a mandated 1 hour lunch break, that's all stuff to consider a private practice. The goal is hopefully that a lot of the tasks of running the business are simpler now than they were a long time ago, from accounting to payroll to benefits, to an EHR that can do some of the billing and claims and collections for yourself. So I think the entrepreneurial spirit level that was required years ago is much lower now. And I would highly recommend anyone that has enough tolerance, enough little entrepreneurial spirit spark, but that really wants the control that comes from being your own boss and running your own practice, then you should go for it in the business for yourself.
Okay, so it sounds like, autonomy and control are the big differentiators for deciding to go with a private practice. How do those things tend to be affected when you're in a group practice?
Yeah. As mental health clinicians, I think we've talked about this before. We are a service industry, and the revenue is generated by providing a service to our patients. When you decide to work for someone else, there's going to be expectations around, there might be flexibility in the hours you can work, especially with telehealth now, but there are going to be expectations with the number of hours of patients you need to see each day or each week.
Right.
There might be expectations on what percent of the patients are hybrid and what percent are in person. There's going to be expectations on when you can take time off, other requests such as that. You won't be the person who gets to decide if you get to have to see a certain patient or not. So if you really prefer seeing a certain type of patient, especially like if you're a psychiatrist that enjoys doing psychotherapy, there are very few employers that allow psychiatrists to do psychotherapy now, because from a business perspective, people will tend to hire psychologists or master's level therapists, which are cheaper and can also provide the therapy service. So a lot of physicians or nurse practitioners are pushed into prescribing medications all day. And I know that a lot of people from medical school at least go into this field because they don't want to do that. They want to have time with their patients and perform therapy. So these are all the considerations regarding your autonomy that you're going to have to give up or not have total control over if you're joining a group.
What about so when I think about this, I think about in private practice, it might just be you. So all of the services rendered, you collect payment, all of that money goes back to you. But then when you're in a group, the providers are the ones that are generating the revenue, but then there might be front desk staff, there might be, high-level executives that aren't clinicians. How does the financial breakdown usually, or I guess what are the financial implications of being in a group practice, versus a private practice?
Yeah, no, that's a really good question, and I should mention so mental health clinicians, there are jobs where you can be a W-2 salaried employee and get benefits, paid time off. Your employer is paying half your Social Security and Medicare tax. There could be group disability and, a full sort of regular W-2 employee like you're working for any other company. But then there are a lot of mental health clinicians that are 1099 contract employees where, you're going to see patients and you're just going to get a flat percentage of the revenue for seeing that patient that the company gets, or you're going to get a flat, dollar amount for seeing each patient. Both of those are different ways of working for a group practice, and there are a lot of mental health clinicians that maybe do 20 hours for a group practice as either a W-2 or 1099 employee, and then also do a private practice for a few other days a week, or split their time between the two. I think the way people who start group practices, and speaking from someone who's, been in running very small practices to very large group practices, the key is what reimbursement rate is. The key is bringing patients to the practice, and then what reimbursement you're getting either from the patients if it's a cash practice, or from insurance companies if you're mainly an insurance-based business. Once you know that amount, then you're going to sort of decide what is going to go to employee pay. If you're a contract employee, at least here in California, but I think this is general throughout a lot of the country, most contracted mental health providers get somewhere between 60 to 70% of the revenue that's brought in from a patient care visit. So if you're a therapist and you see a patient and the company through which you saw the patient gets $100, you'll get somewhere between $60 and $70. And if you're getting less than that, I think you should negotiate and push higher. And on some level, I think that reimbursement is okay, because if you're working as a contract employee, there are still a lot of expenses that the company has to deal with, but that 40% definitely is giving the company enough to deal with, and 30% is probably fine for the company to still take care of the other expenses and pay you. I would say that if you're going to work for a group practice, the money that the revenue that you generate for seeing a patient, you're going to be given a salary for your commitment if you're working as a W-2 employee. And I know that in some of the business models we've done, and that's what's from some other groups, it's more likely that you're going to be getting about 50% of the revenue you bring in, however, as direct salary. However, you're going to get a lot of those other benefits we talked about, like paid time off, health insurance, the extra almost 8% for the employer share of your Medicare and Social Security taxes. And I think it is true that a lot of people in this field, as we talked about, aren't super financially literate, and sometimes don't always consider, I can make much more by contracting with this 1099 group because look how much I get paid per patient. But they don't actually consider the full value of the benefits and that immediate 8% that you get if the employer is paying their half of the Medicare and Social Security taxes. Felt a little long-winded, but is a complicated topic.
Yeah, no, it's well said. While you were talking, I was also thinking about how, when you're in a private practice, you have to do a bit of your own marketing or admin work or billing. And when you join a group practice, though you might not be getting the full reimbursement for the services that you're rendering all the time, you more often than not, you don't have to be thinking about the admin. You don't have to be thinking about the billing. You don't have to be thinking about, doing the outreach to find the patients, because the people who are in charge of running that group practice are generally making sure that stuff is covered, so you don't maybe need to worry about it. Would you say, that's my take. Would you say that seems true?
Yeah, no, that's very true. And so then this gets to that topic of, how much do you value your time, and how much is doing some of that stuff maybe fun, and that entrepreneurial spirit. So, if working on your website is that, this is torture, I hate to be doing this, or hey, this is kind of cool, and you don't mind that your time going to that. It doesn't feel like work, or it has that enjoyment that you're doing something for yourself. But if you're very busy or have small children at home or have a lot of other hobbies or interests, it might be very annoying to do some of the marketing stuff. It might be annoying to do some of the billing, even if things are very automated, right? There's always there's always work that needs to be done to make sure things are going smoothly with the non-clinical part of care. And so it's, for some people, they'll never want to do their own practice because they don't want to do those things that you mentioned. They want to be able to show up, provide good care for their patients, and then go home and not worry about any of the other aspects of running the business and know that they'll get their paycheck every other week or twice a month.
Right. So if I'm a clinician who is, thinking about either or, how should I be assessing what my personal goals are, what my professional aspirations are? How do those things tend to play into this decision?
Yeah, and really, really good question. And I think the answer, and for people who've gone through the training to be in this field, regardless of your degree or background, you should have found multiple mentors or supervisors throughout your training. I think it's really, really valuable to talk to people who've chosen different paths. And you might have an idea about what a solo practice looks like, or hey, starting as a solo practice, but then wanting to turn it into a group. What's it like hiring an admin staff person? So I'd say the first part of the due diligence is have as many conversations you can with people in different fields. Always be aware of the bias that can be experienced, that people, unless they're very disgruntled, will always, consciously or not, push you towards what they've done, which is something to be aware of in those conversations, and why it's important to make sure you speak to several people who've each chosen different career options. But then it's after speaking to those people, looking to, do you have a partner that you need to talk about things with? What are some of those life goals you have planned for yourself? Do you want to retire at age 50 or earlier? Do you want to be working forever because this is sort of a helping person, passionate job? These are all things that can inform your decision. But the nice thing is you're not locked into something once you start. And so you can always change if you've made the wrong decision, and it's somewhat easier. It's a lot easier in this field than a lot of other fields to change your job type.
On that note, I was thinking about how, we're talking specifically about mental health providers right now, but with other medical disciplines, is this? I mean, you're a psychiatrist, but I'm wondering, is this a common experience for other medical disciplines of deciding, am I going to join this hospital? Am I going to start my own private clinic? Can you speak to any of that?
Yeah, no, great question. And I for most other medical disciplines, just starting your own solo practice is not an option. I think, right, you've got plastic surgery, but what used to be very common for family practice doctors, primary care doctors, pediatricians to start their own clinic is the numbers have drastically dropped. I think the percentage is single digits of non-psychiatrists and a few particular fields who are starting solo practices. And that's from the rise of larger groups and consolidation of healthcare costs. So really the option for a lot of medical professionals now is to join a big hospital system, university setting, large group practices. There are groups that you can go into as a partner and work your way up, that after a certain numbers of years, you become a partner, in a physician group or in and then that can lead to some increased profits from the revenue that the business overall is making. But yeah, it would be, I can't think of any of my medical colleagues in other fields that have started solo practices. Yeah.
Yeah. Well, yeah. Glad I thought to ask. So, before we move on, because we're doing a part 1, part 2 for this episode. Before I move on, to our mental health business moment of the week for part 1, is there any other thoughts around autonomy, the financial implications, and professional goals, and really anything that we've talked about?
Yeah, I think for physicians, there's an extra piece around providing. In general, physicians are used to having 24-hour call to take care of their patients. If you're part of a large group or large practice, that call tends to get split up among other people, and there can be some revenue from taking call for doing that. But if you're doing a solo practice, that burden may fall on yourself to handle the call. There are groups of solo practitioners that come together to do call. There is also the issue of, if you want to go to Europe for a couple of weeks, who's going to take care of your patients?
Right.
I've actually found over the years that if you do a good job with your patients and prep them, the after-hour calls are minimal. And I'd rather check email for 15 minutes a day from Europe than try to find someone to provide coverage, actually. So, but those are a couple other things to think about if you're a physician and are going to offer call service. And you definitely need to have coverage when you're out of town, or be able to deal with the things that come up while you're on vacation. So those are a couple other things to think about.
I'm glad you brought all of that up, because I have a whole other episode topic dedicated, in the wings. Maybe we'll do it sometime soon, dedicated specifically to taking time off and how to navigate that. So good little preview of information there. All right. So I think now would be a good time for us to move along to the mental health business moment of the week. What are we looking at this week? Yeah,
so it's on my mind because I just sent another communication to my landlord about this. So I think in our very first podcast, even, we talked about when you're starting your practice, you need to get the licenses you need. And one of those is usually a city license to operate. And we've been operating in Berkeley, California here, coming up on, really almost a year and a half now. And we are operating without a city business license. I don't think I'll get in trouble for saying that. And the reason we aren't able to get our city business license is, although we're in a building that has a lot of mental health clinicians, the suite number that we are in doesn't show up on the City of Berkeley zoning website. And
interesting. Okay.
I actually went in person. They're very nice at the City of Berkeley. I'm like, look, every other suite number is there, but not mine. And then they needed a little drawing, and I did a drawing. And then when it came to it, they're like, wait, you're the tenant? You're not the owner. You can't make this change. Your owner needs to come in and submit this and pay a couple $100s. And my landlord and the owners have just been very slow to do this. And it does, on some level, there are many businesses that operate forever without a city business license and nothing bad comes of it. However, we're very by the books, and we sometimes apply for grants, or if you're taking out a small business loan, they will ask you for your required licenses and permits, and you need that city business license. So gently sent out another. I've talked to the owner in person about this several times, and the progress is not being made, and I just sent another friendly reminder with the context that, I might be applying for some things where we need a city business license.
Right.
Of course, it's one of these situations where you don't want to get kicked out of your space if you're seen as a problem tenant, but come on, man, got to get the license.
Yeah. Wow. That's certainly a unique situation that, well, it sounds unique hearing it, but I think perhaps in practice may not be all of that unique. I don't know. Well, pretty odd that it's the one suite that wouldn't be.
Clearly the practitioner that was in my office before and just retired certainly never had their business license. And it didn't affect them from having a long career in this office, but yeah.
Well, yeah, that's a neat one. So, okay, great. So I think we can go ahead and wrap up for this week. Again, this is a part 1 of part 2. So tune in next week for our second part, where we dive a little bit deeper into some questions specific to group practices, people who maybe are thinking about switching to a private practice from a group practice. So check that out then. Be sure to send us any questions to sitandstay@RipsyTech.com. We would love to answer any questions that you have. Or if you're interested in being on the podcast, we just had our first guest episode last week. Shoot us a message. You never know what might happen. So keep that in mind, and we'll see you next week.
Very good.
See ya.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.